ಶುರು ಮಾಡೋಣ. See, last class I told you about the mind of Causticum, okay? And I just told you about the emotions, okay? If you have any questions in the emotion part, we'll take it up. Otherwise, we will discuss a very important component of Causticum. Emotions, what do you remember? What comes to our mind when we talk of Causticum? They're very, okay, quarrelsome is something that's already there, but anyway, they're quarrelsome. Okay, they have ailments from loss of loved ones, grief. They're very sensitive. What are they sensitive to? They're sensitive to horrible things. They're sensitive to injustice. They're sensitive to cruelty. Or anything wrong happening, they become very sensitive. Okay, and we also saw that Causticum has a lot of anxiety and also fear. Okay, and moving ahead, we also saw that they are very quarrelsome. Now, why do, for what exact reason Causticum quarrels? Why do they quarrel? There are a lot of remedies which are quarrelsome. Okay, starting from Naxwamika till tuberculinum, you see a lot of remedies which are quarrelsome remedies. Each of them, they will have their own reasons why they quarrel. Okay, now why Causticum quarrels is, whenever they see any injustice happening, they start quarreling. If time permits, we'll talk of how to differentiate the quarreling remedies. At least Causticum, they quarrel when there is any injustice happening. For example, you have a Causticum patient. He might quarrel in his office with his higher ups when there is something injustice happening. Okay, and I also told you that Causticum is basically a remedy which belongs to the Cali group. So you will have a lot of similarities. Fine. Like for example, what you prominently see here is there is startling, and they are highly timid. They are very sensitive, and there is also this nature of quarreling, which is more of a Cali trait. Fine. So what we'll do is, I spoke to about a point. This is where we had stopped in the last class, and this point was Causticum can go to the extent of suicidal disposition. Fine. Now, what is it that causes suicidal thoughts, or what is the cause for suicidal disposition in Causticum? Why do they want to commit suicide? Because of disappointment in love. Okay, sadness and disappointment in love, these two things can give rise to suicidal thoughts in Causticum. So this is where I had stopped in the last class, and today I'll just give you a situation, or I'll give you a hypothetical a situation, assuming you have three very important personalities I am coming up with here. One is an union leader. Okay, a union leader, one person, and second is a revolutionist, a person who want to bring in lot of revolutions, lot of changes in the society, the second person, and the third person you see is a very good politician, a very good politician. I know why you are all staring at me, because these three things are not possible. And that's why I told you, I am giving you an imaginary situation, or I am giving you an hypothetical situation. See, we might still have very good union leaders, we might still have a good politician, or we might still have a person who wants to bring in a lot of changes. Now, we'll not look at who they are, do they really exist, do they not exist, we'll not debate on that. But my simple question for you is, what are those characters that you will be looking in a genuine union leader or in a genuine person who is more into the revolution part or a very good politician. What are the genuine characters you expect? Okay, very good. They work for others, and Anika says they have to be honest and they have to work for others. Meaning there should be an element of sympathy, fine. And I'm not right away I'm not getting some movie characters. But if you look at some genuine movie characters where you had a very good union leader who was fighting for his workers, okay, he's not hand in glove with the management, he's not a rich guy, fine, he's a very poor guy and he's fighting for his people, fine, for his workers, okay. So, he can be one example of Causticum. We'll not directly look at Causticum for time being. We look at those characters that you may expect in a genuine person. So you said he should be understanding. Good, he should be understanding. Then what else? Very good, good, beautiful. See, you have to just imagine. I know this is not a possibility or it may not be seen very often in our society. But there are people, there are a good number of people. On this platform I can't take names, but there are people who have worked very hard, who have worked hard to bring in a lot of changes. And we don't even remember them. There are people like them. Okay. So one thing is you should be bold enough to convey the problems against powerful people. Management might be very powerful, but you should have that guts, that courage to convey it. Okay? So you should be courageous, you should be bold, you should have a feeling for your fellow workers, for your fellow people. Good. What else? And okay, and you should also maintain the unity among your people. Good. Anything else you look at? Okay, you should not be money-minded. Good. See, naturally, when you think of money, then you can't do all these things. Probably that's what is happening with the present generation people. We are more behind money. Okay, but genuinely, what else? Yeah, you should have good communicating skills. Agreed. All those things. So, what you have to remember here is, when you look at the characters, that you should have a strong sense of justice. You should know what is right and what is wrong. Okay? You should be bold and you should be ready to fight against the authority. Okay? And you should have a lot of other characters which we'll be looking at. Now, next few minutes, 30 minutes, 40 minutes, depending upon the interaction, I will be touching upon a very important area of Causticum. In the first class, we spoke on the emotions. This class will speak on the will. We'll speak of the will. What exactly you have in Causticum mind related to will? Now, before we get into the Causticum will, now what are all the probable things that comes under will? Will, how do you broadly classify? You broadly classify will into two very important things, weak will and strong will. Yeah, you know the opposites. So, whom do we say you are a weak-willed person? Who is a weak-willed person? Okay, people who can't decide, people who are not courageous enough, brave enough, okay, they all come under weak-willed. People who depend on others. For every small thing, they keep depending on others. Fine. So what could be the probable rubrics under weak will? What could be, see, when you classify will, intellect, emotion, okay, what comes under, no problem, what comes under will? Weak will. Okay, person being indecisive. Okay, good. Irresolute. Confidence want of, good. Want of confidence, yes, Dr. Sunil. Nice point. Confidence want of. Simpler things. Indiscretion. Fine. Okay, indiscretion. Yielding, good. Yielding. You yield. Why are you yielding? Because you are not a strong-willed person. See, yielding as a rubric might be because of different reasons. But one of the important reasons why you yield is because you are not a very strong-willed person. You are weak-willed. I say this, okay. You say that, okay. You don't have a stand of your own. Yielding. Fine. So yielding, confidence want of, indecisiveness, irresolute, indiscretion, all these things can come under weak will. Now, what do you have here in Causticum, which is very prominent? See, under the weak-willed symptoms, what you have here is, they are very timid people. Causticum is a timid person. The beauty of Causticum is, though they are timid, but when something wrong is happening, they pounce upon, they bounce. Now this transformation is very, very important. They are timid. As the miasm blooms, they can become courageous, which I'll try to explain. But if you are looking at the basic nature of Causticum, Causticum is a very timid constitution. Okay? Timidity which is more at night. Timid on going to bed. These are the rubrics under timidity mentioned in your repertoire. Now if you just look at on going to bed and night, you also see reflect into the emotions of Causticum. Causticum is a very fearful constitution. Many fears in Causticum comes when he is going to bed or when he is sleeping. He does not know what is going to happen. So probably we can link the fear which is because of timidity. Now in simple words, what is timidity? Timidity. See, timidity, if you are looking at the word timidity, timidity simple meaning is lack of courage. Lack of courage. Okay. Bashful is more of shyness, which could be because of timidity. Okay. So timidity is a very big rubric, broad rubric. And today we don't have time, otherwise we could have also tried to understand why each constitution is timid, mentioned under the rubric timidity. Must be some other class we'll try to explore, because Causticum is taking a lot of time. Okay? But I have also shown you in few of the previous classes how to study. Okay? So Causticum is timid, okay? One. And excuse me. What you also have in Causticum is, they are the people who are coward. They are the people who are coward. Now how do you differentiate timidity and cowardice? Causticum is timid. Causticum can also be coward. Now how do you differentiate timidity and cowardice? Timid, we just discussed, was, what is it? Lack of courage. Lack of courage. Now what is coward? What is coward? Huh? Okay, good. Aniket has a point. He is looking at the hierarchy, which is more. Which is more, which is more intense. When you look at the clinical utility, is timidity more, should be given more importance, or cowardice should be given more importance? Okay, cowardice will come higher. But how do you differentiate? See, forget about which comes higher and lower. When we don't know the meaning, then how do we take it? So how do you differentiate timidity from cowardice? Practically. Okay. Who is it? What is it? Cowardice or timid? Okay. So Vaishnava has a point, but it's up to us to decide if it is right or wrong. What Vaishnava says is, with higher ups, you become, yeah, you don't have the guts to communicate with higher ups. With lower people? Okay, fine. But this is more of hard on inferiors, soft on superiors, which is coming under the rubric contemptuous. See, now what you need to understand here is, a coward is a person who will run away. Who will run away. Recently one of my assistants had taken a case. There was a mixture of timidity and cowardice. But what made us take the rubric cowardice in him was, he wanted a kind of harmony with everybody. Fine. But when we digged in deep, why he wanted harmony is because, he's a very timid guy, first point. And second point we also realized was, he was a person who was running away from situations. Fine. If I am there in that situation, it might lead to some problem. So anticipating that, he would run away. He has issues with his mother-in-law. He has issues with his father-in-law. But superficially, what is he trying to tell? I am trying to be very cordial with everybody. But when we dig in deep, why are you trying to be cordial? Why this, why that? Ultimately what we realized is, he is a man who is running away from his duties, or is, going away. Fine. So this is more of cowardice. It's got nothing to do with higher up and lower up. Fine. It could be lower people also, or it could be higher people also. Fine. They run away from situations. Simple. See, timidity is still better that way. He's a timid guy. Like I can give you a simple example. Some fight is happening, okay, on road. You have two people here. One is timid and the other one is coward. How do you think both of them will react? A timid person, though he lacks courage, he might still go have a look from a safe distance what is happening. What will a cowardice do? The cowardice will take the next road and he will go away. He's not bothered. Fine. So cowardice is shrinking or running away from responsibilities, running away from real life situations. And cowardice, for your repertorial analysis, is placed higher than timidity. Timidity is a basic rubric. It could be more soric. Cowardice could be more psychotic. Right? It's a higher miasm. So when you have a patient who has both timidity and cowardice, you should give more importance to cowardice. Okay? So Causticum can be timid, Causticum can be what? Coward. Now these are two symptoms I have tried to mention under weak will. Now if you look at the symptoms of Causticum related to strong will, you have got plenty of things here. Now first very important thing, which we all know in Causticum, is that they are the people who have strong sense of justice. What is this? They are the kind of people who have strong sense of justice. Fine. Now that is one reason Causticum cannot tolerate any injustice happening. Now in the background, you also know Causticum is very sympathetic. Okay. Now the sympathetic factor and that strong sense of not tolerating any wrong happening is what you beautifully see in Causticum. Okay. Now which other remedies come to your mind? Injustice cannot support. The only other 3-mark remedy mentioned in your repertory is Stephes agre. Injustice cannot support. Okay. We also have remedies like Merck. We will take up the differentiation a little later. Okay. So that you get a picture of Causticum and then we can compare it better. So I've just mentioned Staff and Merck there, but repertories give you a lot of remedies. Injustice cannot support is the rubric you have in Causticum. Okay. So and again, Causticum is the only 3-mark remedy mentioned in your repertory under idealistic people. So, who is an idealistic person? They have people who have their own values, fine. They have their own noble principles, they have some purposes, some goals. They have their own values. Okay? So they are called idealistic people. Fine, and Causticum is one remedy which is strongly mentioned. See, not only these two things, what you also realize in Causticum is they are very positive people. Okay? So who are positive people? We will also look at the clinic setup. When do you take this rubric positive? Or whom do you consider to be positive? Who are positive people? Okay, I mean, fine. But positive, ambitious itself is a different rubric. You know that, fine. But positive andre no. Okay, Elam has a point. People are optimistic. Good, agreed. Optimistic. Okay. Okay. Yeah. Yeah. So Vaishnav has a point. Like for example, you have a patient who comes to your clinic in the life space. You have seen they have gone through so many things, but they don't give up. Fine. And they look always at some positive thing and they want to come up. Fine. So they don't give up. See, now pertinacity is different. Okay. Obstinacy is different. Being positive is different. There are 3 different rubrics. Must be if time permits, we'll try to understand that. So positive is that person who has a great confidence in himself. So they have got excessive confidence in themselves. For them, the question of doubt will never arise. Very optimistic and sees the brighter side of everything. Okay? Fine? In everything, they will be looking at the brighter thing. Very optimistic people. Even in clinic, no doctor, yeah. I mean, okay, we'll see this, we'll try that. Fine, that's okay, no problem. You give, we'll see what will happen. Okay? So, people with lot of positive attitude. Which remedies? Which are the other remedies? I know, you'll tell me Causticum. Causticum is one. Other remedies. Which are all the other? Okay, you also have phosphorus, good. 1 mark remedy, but no issues. Ferrum, met. Ferrum metallicum and platina are 2 metals which are positive. Ophidia, lachesis. Lachesis is positive. Nux vomica, you can't miss nux vomica. Nux, sulfur, verat, camphor are few remedies which are positive. Okay? So, in the clinical setup, when you see a patient who has got a very positive approach towards things, he looks everything on a brighter way. Fine? You can think of positive. Many times people, they may be having a grave disease, but in spite of that, they don't lose hope. They are not hopeless, they are very hopeful. No doctor, this they don't say for the sake of telling. They are not boosting our confidence. But basically they are that kind of people. Okay? So there you can take positive. Ferrum is one more remedy that you will have to remember. So talking of positivity, another very important symptom that comes up in Causticum is they are very ardent. What is ardent? A-R-D-E-N-T, ardent. Very good. Enthusiastic. See, full of life. Okay? Lot of enthusiasm. That's why after positivity I have brought in ardent. So they are very ardent. People with intense feeling of passion and enthusiasm. They are very passionate people. Anything you see, there is so much of enthusiasm. They are ardent. You might be having few friends of yours, very into, fine, and very passionate. What are the remedies? Nux vomica again, probably all those remedies we discussed here under positive, you also have it there. Nux is there, not ferrum and plat, but nux, phosphorus, ophidia, medorinum, murk, and of course platina. Few remedies, which are ardent. Okay, ardent means very enthusiastic. And what is this? We are looking at the strong-willed symptoms of causticum. Now, what is it that you also have in causticum? Huh? Just try to interpret the image. You might get some feminine. Okay, fine. I mean, yeah, something close. They are going in opposite directions. So, what is that rubric? You tell something that they do opposite. Mother wants the child to sit down. So what will the mother tell the child? Stand up. So what will the child do? The child will sit down. Contrary. So there is a rubric called as contrary. Contrary is doing opposite. Doing opposite. Okay. So sit down, the child will stand up. So the mother knows when I say sit down, the child will stand up. So what will the mother tell? Stand up. So the child will sit down. So this is contrary behavior, opposite behavior. Okay. So causticum comes under contrary, and other remedies. Other remedies. What are the other remedies? Huh? More than Verat. Okay, Verat. Agreed. Good. See, who are those constitutions who are so strong that they do opposite? That is what you need to understand and answer accordingly. Okay, it could be platina, very hearty remedy. So again, why each of them are having contrary behavior, you will have a reason. So here we have tarantula, we have hepar, and of course murk, a very dominating remedy, very disobedient remedy. We will discuss murk a little later. We also have lachesis, chamomilla, anacardium, and argentum nitricum. Okay, few contrary remedies. See, not only contrary, what you also see there in the other icon there is people who are, you are looking here, but I am looking at this particular child. Disobedient children. Children who don't obey. Disobedient children. Okay, not obeying. Now, what other remedies we have here? Top remedies we have here is, again all these remedies, murk, tarantula, lachesis, lyco, syphilinum and tuberculinum. These are few disobedient remedies. See, disobedience, and one more very important thing we just spoke a little while ago is stubborn. What is it? Stubborn. What is stubborn? They stick to their point. Fine? They stick to their point. Okay? I decide I will stand here. That's all. It's over. Whatever you do, I will not budge from this. So, obstinate, stubborn. You have one more higher to this is pertinacity. Pertinacity. Fine? You have some 18 remedies. Beautiful rubric. I have used often in my clinic, which is higher than stubborn. If they decide, it's over. Okay? I don't know, in one of my lectures I have shared a case of a child. The child was crying, and it was non-stop crying. I was taking the history from the mother, and the child was crying. And after some 30-40 minutes, the child stopped crying. And the child entered with her dad, very small child, 2.5 years old child, with a candy. They have come for cold cough, okay, to my clinic, and mother was just giving the history. The child saw an ice cream shop in opposite to my clinic, and he decided he wants to have an ice cream. But what is the situation? He's got cold and cough. Now what I am trying to tell you is, half an hour, why I mentioned that is, he was non-stop crying. When did we not listen to the child's cry? When his desire to have an ice cream was met. When the ice cream was given, he stopped crying. Now that's where I took the rubric pertinacity. Mother says, sir, if you decide something, we have to give up. Fine? He wins. So people who decide and, till it is done, there you can take it as pertinacity. So obstinate and something higher to disobedience is what we call it as. Any wild guess? What is something more higher than disobedience? Disobedience is more passive. You don't obey. But when it takes an active form and when you openly going against somebody, then we call that as defiant. We call it as defiant. Defiant is next level of disobedience. Next level of disobedience, act of standing up to an opponent or an authority. Going against an authority. Okay? See, stubborn is sticking to your point. Okay? You need to understand the difference between stubborn and defiant. Stubborn is you stick to your point. What happens in defiant? You are going against some authority, some higher up, some superior. Okay, your boss, your colleague, whoever it is. Fine? Acting against the authority. Now, mind you, though I am giving you the meanings and trying to give you a clinical hint, ultimately what are we trying to understand? Which remedy we are trying to understand? We are trying to understand Causticum. So what you need to understand here is, why Causticum will become defiant? Why Causticum is standing against the opponent or the authority? Why is he standing? Why is Causticum defiant? Causticum is defiant because there is some injustice happening. There is some injustice happening. So he is, going against the authority. So injustice, that is the core you need to understand here. And everything that I am speaking today in this class will have that, base of he not tolerating injustice and he being very sympathetic. Okay? These two things you will have to keep it in your mind. Okay? So moving ahead, as the pathology progresses, as the miasm blooms, what you also see is, what is this icon trying to tell us? That Causticum can go into a rebellious mode. So I am just trying to give you the hierarchy. We started with he being positive, he being ardent, fine, he being disobedient, we went to defiant, we are talking of rebellious, fine. So who is termed rebel? Whom do we term rebel? It is, then we term them as rebel. So Causticum, showing a desire to resist the authority or the control. He is trying to go against them. He is trying to resist the authority. Rebellious person. One of the important remedy we have in our repertoire is Causticum. In the next level, you can also see them going into the stage of revolution. So under the rubric revolutionist, you have Causticum. Fine. Now, moving ahead, as the pathology goes, what you also see here in Causticum is they can become anarchist. They can become anarchist. Who is an anarchist? Anarchy. Who is an anarchist? Yeah. See, people who don't believe in government, fine, in rules, they are the people who believe that there should be no rules, there should be freedom, fine. So, Causticum, people who oppose any kind of laws, any kind of rules, any kind of government or authority, they are called as anarchists. So you see how the Causticum, mind, how things slowly starts fitting in, okay? And from sympathetic, from a person who has a strong sense of justice, from there how slowly it will move on. So they are very vulnerable, they can get attracted to different groups, different organizations. We see many movies, fine? And at this stage, they can also take a wrong path. If their brain is washed, they can join a terrorist organization. They can blow up this, they can blow up that, fine? And ultimately what you also see in Causticum is, they become fanaticism. You have fanaticism which slowly comes up in Causticum. Now what is fanaticism? Okay, madness. Your friend puts it in one word, madness. Can you go beyond madness? Yeah, yes, it's a kind of madness. I'll explain what fanaticism is. It's a kind of madness. But what are they mad about? Beautiful, good. I didn't have this in my PPT, but what are they mad about? Good. They are mad about certain principles. Okay? They are mad about certain person. They are mad about certain political group. They are mad about certain organization. Fine? See, they blindly follow somebody. Fine? There will be no reasoning. See, we say fanaticism has come from the word fan, F-A-N. I am a fan of a certain actor and I am ready to do anything for him. That's where we say, no, he is fanatic. Fine? I can do anything for him. Whatever he does, he is giving blood. Okay, fine, I also stand in the queue and I give the blood. Fine? I mean, I'm talking of good things, but many times they may do bad things and we blindly follow them. So, fanaticism is a belief or a behavior involving uncritical zeal or an obsessive enthusiasm. See here, the reasoning is lost and we just blindly follow. Many times we follow some cult. Fine? And not only following, we are ready to do anything for that cult. That is fanaticism. Okay? See, this, it could be for religion. You would have heard of religious fanatics. Or it could be a sport. I am a cricket lover. Fine? And I can do anything for cricket. You are a tennis lover, you are some other sport lover. Fine? And you go to any extent. And it could be a political party. It could be a political ideology. Fine? So you don't have your own reasoning and you strongly stand up and you are ready to do anything for that. Okay? Or it could be for a person. Fine? Or many times we have homeopathic fanatics. I mean, they will not touch allopathy. I know, homeopathy is a beautiful science. Fine? And we have done wonders. But sometimes we might have our own limitations. We have patients, we have some doctors, 105 fever, 106 fever. No sir, I want to give this. Fine. I mean, sometimes we don't get the right simillimum. We may have to give paracetamol, but they don't believe. I mean, no. Yeah, I mean, what I am today is because of homeopathy. I have got nothing against it. But we see some of our, homeopathic friends so much deeply rooted. Okay, fine. So, fanaticism is what you need to understand. It could be religious, fine. Or in Causticum, it's more with some ideology. So many of I don't know if I can use all those words here, many of the communists, fine, and many of the, who are they called, we have issues in Naxal group, fine. I don't know, when I was checking with one of my friends, the ideology when they started was something very different, So those groups, they had some great ideologies. And even today, those leaders, they are very poor. They don't get sold by some government, some management. They still live with lungi, with torn banyan, but they're fighters. They got a lot of following. They fight for a cause. They could be causticums, not for money. Fine. Great union leaders. Must be his wife will be cribbing. This point I have taken from Vijaykrishna's book. He writes in a paragraph, he says, must be his wife will be cribbing. You are a union leader of such big factory, such big industry. See the kind of life we are leading. We don't have fridge, we don't have TV, we don't have proper clothes to wear. That is not important for him. What is important for him? His people, his ideology. Fine, there are so many workers who believe in me. I should do justice to them. Something happens, he'll go run. Not for the sake of posing, because he is genuinely concerned. They are the people who are causticums. Probably we don't use causticum so often in our clinic because we don't get genuine causticums to conclude the class. Or we are not able to identify those causticums. And probably that's why this picture of causticum is getting missed. A psychotic world, money-minded world, many of us are behind all those things. But today's picture of causticum is more of this, a strong sense of justice, very enthusiastic, very defiant, very courageous, a guy who has got guts to talk against the management, keeping his workers in mind. Fine? So they are more of causticums. We can think of some names, though we will not name them here, for our understanding. After the class, we can discuss some names, who could be genuine causticums. So that when you look into their life, you can relate causticum better. We will talk of those names after I switch off the video. So any other inputs, anything you would like to ask? Before you ask and before I forget, I promised to compare two remedies. Now what were those two remedies here? Which comes very close to causticum is Staphylos aureus. Now how do we differentiate Staphylos aureus from causticum? Staph also has good sense of justice, fine. But how is causticum different from Staphylos aureus? I gave you a picture of causticum. Causticum is a fighter. Causticum will fight, fine. He can become a revolutionist. He can rebel. He can go against the authority. But Staph will not do all those things. Now, what is that only thing that you see in Staph is they have bad anger. When something wrong is happening, they go into a bad anger. Fine? They become very angry. So what you have in causticum is, what you have in Staphylos aureus is more of indignation. In causticum you don't have indignation. Fine? But in Staphylos aureus you have more of indignation. That's one very important point. Now coming to murk and causticum, they come very close. Starting from Sora, murk and causticum both are very timid. Timid people, when the situation arises, they become very, aggressive. They can't stand injustice. But the difference is, murk is when injustice is happening to himself. This is a beautiful point, please remember. When something wrong is happening to himself, he fights. Fine? Causticum, on the other hand, when some injustice is happening, not necessarily it is to him, it can be to anybody, causticum reacts. Now why do you think murk is reacting only if it is happening to himself, and why is causticum reacting if it is happening to somebody else? Beautiful, good. Now what is it that is missing in murk? Murk is not a sympathetic person. Murk is not a sympathetic person. Under the rubric sympathetic, murk is not there. Fine? So causticum is there under sympathetic, and he feels anxious for others and then he tries to fight for them, he tries to help them. So Mark only is more of a selfish person. Only when problems happen to him, he fights. This is one thing. And another very important thing, Mark is given under hatred. Causticum is not there under hatred. Rubric. Okay. Mark can carry grudge. Mark, see, if Mark has some problems with you, Mark can carry grudge. He can hate you. But Causticum, once his issue with you is solved, he will not harm you. He will not carry the grudges further. The issue is there, issue is solved, fine. He fought for his people, that issue is resolved, he has no bad feelings for you. But Mark can carry, is more syphilitic. Mark can carry those negative vibes. Okay? This is one very important difference between Mark and Causticum. Fine? So, if you have anything to ask, huh? Okay, see, Ferrum, from what we have understood, Ferrum is a strong person. Now, what is Ferrum? Ferrum is iron. Allah. And what does iron represent? What does this iron thing? It talks about strength. Our buildings, whatever it is, it's all made up of iron. Fine. So, iron, when you're talking of Ferrum, they're generally very strong constitutions. That's why they come under lot of positive kind of a personality. Fine. So, Ferrum, I don't know much about the injustice cannot support part. But what Ferrum I have used in my clinic are those constitutions generally who are very strong and very positive. Fine. And things they'll never bend. Once they decide, that's it. I was sharing a case of Ferrum with you. We have some 80 years old gentleman who still comes firm, straight like this. And his kids even today, they are 52, 54 plus. Even today, they shiver talking to him. So that is a kind of aura personality Ferrum carries. A very strong constitution. Okay, strong, positive, fine, dominating constitution is more of Ferrum. Anything else?
Some people, when they see damaged roads or some injustice happening, they don't, they write it.
Yeah, beautiful. Yeah, thank you for reminding. See, there's a point, I'm happy Vaishnavi got it right. People who write and complain. Now, that's what she was trying to tell. And if you have not heard it right, what her question is, when you see damaged roads or when you see something unfair happening, they will not fight straight. Fine? Okay? They will not fight like Mercury. What they do is, they write to the authority. They write to the municipal council or municipal authority, they write, see, this is the road is all bad, please do repair, etc., etc. Or they might write it to the newspaper. Fine? So these people, we have a rubric. And what is that rubric? Litigious. There is a rubric, litigious. Fine? We have some 6 remedies, and one remedy under litigious is Causticum. Okay? Causticum is there, if I am right, arsenic is there, lacasse should be there, but some 6 remedies are there. Fine? Arsenic, Causticum, lacasse, I am not sure if plat is there. You should see it under quarrelsome. You have a rubric quarrelsome, under quarrelsome you have litigious.
Arsenic, Causticum, lacasse, nitric acid, nux vomica,
Okay. Okay. So there are 7 remedies. Nitric acid, platina, stephysagria, lacasse, Causticum, arsenic. Yeah, fine. So these are the remedies. So people who write to the authority and complain. Fine. So litigious. Okay. Who? Yeah. Causticum, this is Causticum that we are talking about. Causticum is one of the top remedies for anarchists. Okay. See now what you need to understand is, you need to build a picture like this. They are not born anarchists. Lot of events should have happened. Lot of built up will be there, where they go to the extent of anarchist. Adike I have tried to explain it to you in different levels. Okay. Must be they become revolutionists. In spite of that, the injustice continues. Probably then they might go into this state of anarchist. Fine, what is the use? I have been a rebel, I have fought, I have organized protest, strike, nothing is happening. So I don't believe in government. Fine. See, this is how the drug picture is building up. And that's why it might be my hypothesis, but this is how I have understood Causticum from source books, some lot of books. It's not my thought. Lot of books I have referred, and I have assumed must be this is how it is. Okay, so they are not born anarchists. Lot of events in their life would have taken place which would have made them an anarchist. They will not believe in anything. Why this government? Why this law? Why these rules? See, if a person has gone through that extent, then there will be a lot of story behind it. Okay? And that is what I was trying to give you in the flashback, in the background, what all could have happened, why Causticum has come to this stage. And in the end stage, I told you, probably this is the stage where, even if I remember, I was reading Materia Medica Viva by Professor Vitolkas. Even there he says, at this stage, they go to the extent of becoming terrorist. I did speak about that. They will be in a very vulnerable position. And probably in the next stage, they can do any damn thing. Fine? They can follow some organization, some religion, some cult, something very seriously. And they can do more damage. And this is how the miasm blooms in Causticum. Even Dr. Shankaran's book, Soul of Remedies, if I am right, beautifully he has described Causticum. He has compared with phosphorus. How Causticum and phosphorus are different. See, these are all the source books. You should read. Fine? Okay? And you can add to it and get a picture. Okay? Any more questions? See, if all fine, what we'll do is next class we'll try to take up the intellect of Causticum. And with that, I'll try to end Causticum. See, these are all the methods, models, what I'm trying to give you, how you can study a remedy at the PG level, and you can use the knowledge better. Okay, thank you, thanks.